Is there such thing as dumping syndrome after gastric sleeve?
3, 2, 1.
Here we go!
Dumping syndrome indeed is a condition that can occur rarely after gastric sleeve surgery, and there are ways we can avoid it. But first, we need to know what dumping syndrome is and what triggers it so we can prevent it. Dumping syndrome is a condition that can occur after surgery that removes all or part of the stomach, a gastrectomy, or after esophageal surgery as well. It can also occur in people who have had surgery that bypasses the stomach to help them lose weight, which is bariatric surgery. Dumping syndrome happens when food, especially sugar, moves too quickly from the stomach to the small intestine. And there are two types of dumping syndrome: early and late. Early dumping syndrome symptoms occur usually 10 to 30 minutes after eating, and symptoms include nausea, vomiting, bloating, cramping, diarrhea, dizziness, etc. Now, these symptoms are due to the rapid movement of the food into the small intestine, which causes a shift of fluid from the bloodstream into the intestines. Now, late dumping syndrome usually occurs 1 to 3 hours after eating and are mainly related to low blood sugar levels, which is hypoglycemia. And symptoms include tremor, shakiness, sweating, dizziness, confusion, etc. Now, these symptoms occur as the body releases large amounts of insulin in response of the rapid absorption of sugar from the small intestine. So you might be watching this video and thinking to yourself, wait a minute, I have not even heard about this before. I don't have any problems whatsoever with my sleeve, nor do I feel anything weird after I eat. Well, the reason is because dumping syndrome is not that common after gastric sleeve surgery. It may, just maybe, happen maybe 1 out of 10 patients, or even less than 1 out of 10 patients may indeed experience dumping syndrome at some point. So you might as well be watching this for the rest, or watch the rest of the video for educational purposes. So dumping syndrome can occur after gastric sleeve surgery, although again, much less common compared to other bariatric surgeries. For example, the Roux-en-Y gastric bypass, which is on the bypass, it is a common feature of that surgery. The frequency of dumping syndrome after gastric sleeve varies, as I just mentioned, but by far less prevalent than other procedures. So what can we do to prevent dumping syndrome after gastric sleeve surgery? Well, 1, we need to make some dietary changes, eat smaller, more frequent meals. Instead of, let's say, 3 large meals, aim for 5 or 6 smaller meals throughout the day. This helps prevent the stomach from emptying too quickly into the intestines. Avoid high sugar and high fat foods. Foods high in simple sugars and fats can trigger dumping syndrome. So avoid sweets, candy, soda, cakes, and other high sugar items. Increase fiber intake. So consuming more fiber can help slow down the digestive process and reduce the risk of dumping syndrome. We also need to make some changes in our eating habits, like eating slowly, eating slower. Take your time to chew food thoroughly and eat slowly to avoid overwhelming your stomach. Avoid drinking with meals. Do not drink liquids immediately before, during, or after your meals, because this will definitely speed up the gastric emptying. It will flush down. For patients with diabetes or insulin resistance, keep an eye on your blood sugar levels throughout the day. Stay hydrated. Drink plenty of water throughout the day. But Avoid drinking large amounts right before or after your meals. Avoid problematic foods. So, in other words, identify trigger foods. Pay attention to foods that cause you digestive issues and avoid them. Common culprits include refined sugars, as I mentioned, or high glycemic foods. By following these dietary lifestyle modifications, you can significantly reduce the risk of developing or having dumping syndrome after your gastric sleeve surgery. As always, my recommendation, if your symptoms persist, consult with your healthcare provider to evaluate or manage your specific situation. Did you enjoy the content? I would greatly appreciate it if you can leave me one of these, since it helps us to get this content out to more people who are interested in this topic. Also, maybe consider subscribing down there. Subscribe to the channel. It is completely free, and that way you don't miss out on future episodes. Thank you so much for watching. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.